honoring Black mothers, pillars of strength and resilience. Black mothers are the backbone of our communities. They are the silent heroes who hold our families together, often without recognition or praise. They are our nurturers, our educators, and our advocates. From the earliest moments of life, they instill values, impart wisdom, and provide unwavering support. They carry within them a strength that has been passed down through generations, a resilience forged in the face of adversity. This resilience is not just a personal trait, but a collective heritage. Black mothers are the heart of our families and the soul of our nation. Their love and dedication create the foundation upon which future generations stand. Yet, when it comes to maternal health, they face a system that too often fails to protect them. Despite their strength, they encounter significant barriers in accessing quality health care. This video delves into a silent crisis affecting Black mothers. It is a condition called Intrauterine Growth Restriction, or IUGR. This condition, often overlooked, has profound implications for both mother and child. We will explore the medical reasons behind IUGR, the stark racial disparities that persist, and the devastating impact of stress and systemic racism on Black maternal health. These factors combine to create a perilous environment for Black mothers. This is a call to action for all of us, policymakers, healthcare providers, and community members, to stand in solidarity with Black mothers and demand better. We must work together to dismantle the barriers they face. Their lives and the lives of their children depend on it. By supporting Black mothers, we ensure a brighter, healthier future for all. Understanding intrauterine growth restriction, or IUGR, is a serious pregnancy complication that can have lasting impacts on both the mother and the baby. It occurs when a baby doesn't grow to a healthy weight while still in the mother's womb, which can lead to various health issues. This can happen for a variety of reasons, some stemming from the mother's health, some from the baby's, and sometimes a combination of both. Maternal factors include chronic conditions and lifestyle choices. Conditions like high blood pressure, diabetes, and autoimmune diseases in the mother can contribute to IUGR. Additionally, poor nutrition and substance abuse can also play a role. Problems with the placenta, the organ that nourishes the baby, can also restrict growth. This includes issues like placental insufficiency or placental abruption. Additionally, certain infections, genetic abnormalities, and birth defects can increase the risk. These factors can complicate the pregnancy and affect the baby's development. Babies born with IUGR are at a higher risk for a number of health problems. These can range from immediate issues at birth to long-term developmental challenges. These can include low birth weight, premature birth, breathing difficulties, feeding problems, and developmental delays. Early intervention and medical care are crucial for these infants. In severe cases, IUGR can even be fatal. It is essential for expecting mothers to receive regular prenatal care to monitor the baby's growth and address any complications early. The shadow of disparity. IUGR and the plight of Black mothers. While IUGR affects mothers of all races, Black mothers experience it at a significantly higher rate than their white counterparts. This disparity is alarming and points to systemic inequities in healthcare access and quality. Research has shown that Black mothers are more likely to have underlying health conditions that can contribute to IUGR. These conditions, often rooted in social determinants of health, are exacerbated by a lack of access to quality health care, nutritious food, and safe housing. The stress of living in a society that devalues Black lives also takes a toll. This chronic stress, fueled by experiences of racism and discrimination, has been linked to adverse pregnancy outcomes, including IUGR. Stress, racism, and healthcare bias, unraveling the roots of inequality. The higher rates of IUGR among Black mothers cannot be separated from the pervasive impact of racism and bias in healthcare. Black women often report feeling unheard or dismissed by healthcare providers, leading to misdiagnoses, inadequate care, and a lack of trust in the medical system. Implicit bias, conscious or unconscious prejudice, can also influence how healthcare providers interact with and treat patients. This can manifest in subtle ways, like spending less time with Black patients or offering them fewer treatment options. The cumulative effect of these experiences is a system that perpetuates health disparities and puts Black mothers at increased risk for pregnancy complications like IUGR.
Amani, a vibrant young woman with a radiant smile, was excited to welcome her first child into the world. She had always dreamed of becoming a mother and was overjoyed when she found out she was expecting. Her days were filled with anticipation and planning for the new addition to her family. Her pregnancy had been relatively smooth until her third trimester, when she started experiencing persistent headaches and swelling. These symptoms, which she initially thought were just part of the pregnancy journey, began to intensify, causing her significant discomfort and concern. Despite raising these concerns with her doctor, Amani felt her worries were dismissed. She was told that these symptoms were normal and that she had nothing to worry about. However, Amani couldn't shake the feeling that something was wrong. Weeks later, during a routine checkup, Amani learned her baby wasn't growing at the expected rate. The news was devastating. She was diagnosed with Intrauterine Growth Restriction, IUGR, a condition that meant her baby was not getting the necessary nutrients to grow properly. This diagnosis brought on a wave of fear and uncertainty. Amani was overwhelmed with questions and concerns about her baby's health and future. The joy she once felt was now overshadowed by anxiety and fear. Amani's story is not unique. Many Black mothers face similar challenges during their pregnancies. They often find themselves battling not just the physical aspects of pregnancy, but also the systemic barriers within the healthcare system. It reflects the experiences of countless Black mothers who navigate a healthcare system fraught with systemic barriers and implicit bias. These barriers can lead to delayed diagnoses, inadequate care, and a lack of support during critical times. Amani's experience underscores the urgent need for a more equitable and just maternal healthcare system, one that centers the voices and experiences of Black mothers. By addressing these systemic issues, we can ensure that all mothers receive the care and support they need for a healthy pregnancy and beyond.
Addressing the disparity in IUGR rates requires a multifaceted approach that tackles the issue from multiple angles. We must dismantle the systemic barriers that prevent Black mothers from accessing quality health care and create a system that is responsive to their unique needs and experiences. Expanding access to affordable, comprehensive health care is paramount. This includes prenatal care, mental health services, and social support programs that address the social determinants of health, such as food insecurity and housing instability. Implicit bias training for healthcare providers is crucial to dismantling unconscious prejudice and fostering culturally competent care. Diversifying the healthcare workforce is also essential to ensure that Black mothers see themselves reflected in their providers. The fight for Black maternal health is a collective responsibility. It requires a commitment from all of us, policymakers, healthcare providers, and community members, to dismantle the systems that perpetuate inequity and create a future where all mothers have equal opportunities for healthy pregnancies and births. Policymakers must prioritize legislation that addresses the social determinants of health, expands access to affordable health care, and holds healthcare systems accountable for addressing racial disparities. Healthcare providers must examine their own biases, actively listen to their Black patients, and advocate for equitable care within their institutions. Community members can play a vital role by supporting organizations that are working to improve Black maternal health, raising awareness about this issue, and holding elected officials accountable. The well-being of Black mothers is not just a matter of individual health. It is a matter of social justice. When Black mothers thrive, their families thrive, and our communities thrive. It is our collective responsibility to dismantle the systems that perpetuate inequity and create a future where all mothers have an equal opportunity to experience the joy of motherhood without fear or compromise. Let us stand in solidarity with Black mothers, amplify their voices, and demand better. Together, we can create a future where every mother, regardless of race, has the opportunity to experience the miracle of birth with dignity, respect, and the promise of a healthy future. The fight for Black maternal health is a fight for justice. It's a fight for equity. It's a fight for the recognition that every Black mother deserves to bring her child into the world without fear, without compromise, and with the full support of a healthcare system that values her life as much as it values any other. The time for complacency is over. The time for excuses is over. The time for action is now. Let us rise to meet this moment with courage, with compassion, and with an unwavering commitment to creating a future where Black mothers are no longer denied the basic human right to a safe and healthy pregnancy and birth. The strength and resilience of Black mothers is a testament to the power of the human spirit. Despite the challenges they face, they continue to nurture, to love, and to lead. It is our duty to honor their legacy by creating a world where their voices are heard, their experiences are valued, and their lives are protected. Let us work together to build a future where every Black mother can embrace motherhood with joy, dignity, and the unwavering belief that her life and the life of her child truly matters. Whether you're a mother, medical professional, policymaker, or passionate advocate, you have a role in this fight. Please like, share, and subscribe.